الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. محاضرتنا لهذا اليوم عن البليدنج disorder، وهي المحاضرة الخامسة من chapter الهيماتولوجي. What is hemostasis? It is the process of blood clotting in areas of a blood vessel injury. When an injury occurs, the clotting how to develop by hemostasis. The main component of the hemostatic process are the blood vessel wall, platelet and coagulation protein, anticoagulant protein, and fibrinolytic system. Most common bleeding disorder is hemophilia and mainly factor 8 or 9 deficiency. Hemophilia A is factor 8 deficiency, hemophilia B factor 9 deficiency, hemophilia C is factor 11 deficiency. Hemophilia is inherited as an X-linked recessive disorder. Hemophilia A occurs by spontaneous mutation. Through lionization of the X chromosome, some female carriers of hemophilia A or B have sufficient reduction of factor 8 or 9 to produce mild bleeding disorder. As you know, all the diseases which are inherited as an X-linked recessive, the male will be diseased and the female will be carrier. But if there is lionization of the X chromosome of the carrier female, she will develop the disease. Clinical manifestation of hemophilia. Bleeding symptoms may be present from birth or may occur in the fetus. About 30% of male bleed with circumcision. Bleeding depends on the degree of the factor in the body. If the level of the factor is less than 1%, that is severe hemophilia, he will develop spontaneous bleeding or bleeding with minor trauma. Second, if the level of the factor is 1 to 5%, moderate hemophilia and usually require moderate trauma to induce bleeding episode. 3. If the level is more than 5%, it is mild hemophilia and significant trauma is necessary to reduce bleeding. يعني قد ما يكون الليفل أقل، التروما to reduce bleeding تكون أقل. level of the factor يزيد، يحتاج إلى severe trauma أو significant trauma to reduce bleeding. The hallmark of hemophilic bleeding is hemarthrosis. يعني children mainly bleed in the joint. Young children, the ankle joints are involved. Whereas in older children, the elbow and the knees also involved. Repeated bleeding episode into the same joint may become a target joint. Life-threatening bleeding is caused by bleeding into vital structures like CNS, upper airway, gastrointestinal tract, and iliopsoas muscle. If bleeding occurs in these, it will be life-threatening bleeding. Differential diagnosis. In young infant with severe bleeding manifestation, the differential diagnosis include either severe thrombocytopenia or severe platelet function disorder, such as Bernard-Solier syndrome and Nelsman thrombasthenia. Other differential diagnosis type 3 von Willebrand disease اللي هو severe type Also, vitamin K deficiency may lead to bleeding. All these are differential diagnoses of bleeding disorder, like hemophilia. Laboratory finding and diagnosis. How you diagnose a patient with bleeding. Activated partial thromboplastin time is prolonged. Platelet count, normal. Bleeding time, normal. Prothrombin time and thrombin time all are normal. Which is affected is the intrinsic pathway only of hemostasis schedule. So intrinsic is affected, lead to prolonged APTT only. Specific assay for factor 8 and 9. This is very, very specific to diagnose which factor is affected. Unless the patient has an inhibitor to factor 8 or 9, the mixing of normal plasma with patient plasma results in correction of activated partial thromboplastin time. If correction does not occur on mixing, an inhibitor may be present. يعني مريض عنده deficiency بالفاكتور من نضيف ناخذ بلازما من هذا المريض ونضيف له نورمال بلازما من شخص اعتيادي ما عنده نقص بالفاكتور راح يصير correction بالاكتيفيتد partial thromboplastin time. لكن إذا ضفنا النورمال بلازما إلى بلازما المريض وما صار correction نفكر بأنه قد يكون موجود an inhibitor للفاكتور. شلون نشخص الانهبيتر؟ by quantitative VISTA assay for the inhibitor. Treatment of hemophilia. How do we treat a patient with hemophilia and he is bleeding? He has bleeding. The hemostatic level for factor 8 is more than 30 to 40%. يعني لازم نوصل الليفل إلى 30 إلى 40% حتى نقدر نسيطر على النزف. حالة الهيموفيليا أي factor 8 deficiency. لكن بحالة الفاكتور 9 نوصله 25 إلى 30%. If you are in the casualty unit and the hemophilic patient present to you with bleeding, what is the dose and how you manage this bleeding? First of all, you should calculate the dose of factor 8 or 9 to be given to the patient. الدوز في حالة factor 8 تساوي percentage desired rise in the factor multiplied by the body weight and multiplied by 0.5. يعني وزن الشخص، وزن الطفل في الليفل اللي نريد نوصل له هو ونقسمه على 2. هاي بحالة الفاكتور 8. الفاكتور 9 نفس الشيء desired level في الوزن في 1.3. قد تطلع النتيجة باليونت. نجي نشوف الفيالات اللي عندنا اللي بيها الفاكتور لايوفلايزد فاكتور ونحسب الدوز اللي يحتاجه المريض حتى يصل الليفل المعقول اللي نريده. عادة في جميع الأحوال نوصله 30 إلى 40%، ما عدا باللايف ثريتنينج بليدنج نحاول نوصله إلى 100%. هذا في حالة إنه المريض وصلنا وعنده بليدنج ونريد نوقفه. لكن الحل الأمثل هو البروفيلاكسيس. البروفيلاكسيس is the standard of care for most children with severe hemophilia to prevent spontaneous bleeding and early joint deformity. من البداية من شخصان مريض هيموفيليا نبدي معانا والسكيدجول مال prophylaxis. If target joint develop, secondary prophylaxis is initiated. With mild factor VIII hemophilia, the patient endogenously produced factor VIII can be released by، يعني في حال إنه الليفل أكثر من 5% هو مع الهيموفيليا المريض يقدر يفرز الفاكتور داخل الجسم if we give him desmopressin acetate. A concentrated intranasal form of desmopressin acetate. It is not the enuresis or the pituitary replacement dose، لأنه الديسموبروسين أيضا يستعمل في حالة الانيوريسيس. هون لا غير دوز نستعمل. Can also be used to treat patient with mild hemophilia A. يعني الديسموبروسين نستعمله بالmild hemophilia A نستعمله بالانيوريسيس in different dose. The dose here is 150 microgram اللي هي 1 spray بخة واحدة for children اللي يوزنون أقل من 50 كيلوغرام. وضعف الدوز اللي هي 300 مايكروغرام 2 spray بختين intranasal for children and young adult weighing more than 50 كيلو. يعني اللي أقل من 50 كيلو وزنه بخة واحدة بالأنف اللي تعادل 150 مايكروغرام، واللي أكثر من 50 نستعمل معاهم بختين. A preliminary trial of factor 9 gene therapy are underway. يعني هاي محاولات إن شاء الله في المستقبل تستخدم gene therapy في جميع الأمراض. Mucosal bleeding may require use of antifibrinolytics such as aminocaproic or tranexamic acid. Imiximab can bridge activated factor 9 and factor 10, thus restoring functional activated factor 8 activity. يعني يعبر لنا الفاكتور 9 factor 10 يحافظ لنا على functional factor 8 in patient with hemophilia with or without factor 8 inhibitor. حتى لو كان عنده inhibitor أو ما عنده inhibitor الإميكسيماب يفيدنا بهذه الحالة. A prophylaxis be considered optimal therapy for severe hemophilia. البروفيلاكسيس مثل ما ذكرت لكم من شخصنا المريض عنده severe hemophilia نبدي معانا بالبروفيلاكسيس. أكو primary prophylaxis و secondary prophylaxis. The primary prophylaxis program initiated with the first or second joint hemorrhage. Young children often require the insertion of central catheter to ensure venous access. يعني يبقى معانا هذا السنترال كاثيتر ويتعلم شلون ننطي الفاكتور بالبيت والدوز نحسب له هي يستعملها. هذه primary prophylaxis حتى نمنع الفردر bleeding. من صار عنده first أو second joint hemorrhage نبدي معانا primary prophylaxis. A secondary prophylaxis is frequently initiated if the target joint develop in older children who is not given primary prophylaxis. مثلا مريض ما كان بدينا معانا بالprimary prophylaxis وصار عنده recurrent bleeding in the same joint، صار عنده target organ، فبالحالة هذه نبدي معانا بالsecondary prophylaxis. How we treat inhibitor for factor 8 or 9. By continued regular infusion of the factor or desensitization program in which high dose of the factor 8 for hemophilia A or factor 9 for hemophilia B are infused in an attempt to saturate the antibody and permit the body to develop tolerance. Rituximab also is effective for the treatment of inhibitor. If desensitization fail, bleeding episodes are treated with either recombinant factor VII or activated prothrombin complex concentrate. Supportive care for hemophilic patients. Anticipatory guidance including the use of car seat belt, and bike helmets and the avoidance of high-risk behavior حتى نقلل من مخاطر التعرض للنزف. تعمل المقعد الخاص مع الأطفال في السيارات والحزام والقبعات الأمان وقدر الإمكان يتجنب المناطق المرتفعة والشاهقة وأي لعبة بيها حديد أو بيها خطورة يتجنبها. Patients should avoid aspirin and other non-steroidal anti-inflammatory drugs. The child with a bleeding disorder should receive vaccination against hepatitis B and should be screened periodically for hepatitis B and C, HIV, and any abnormalities in the liver function. كل المرضى اللي يحتاجون إلى دم أو يحتاجون إلى عوامل تخثر should be screened for hepatitis B and C and HIV or any abnormality in the liver function. Chronic complication of hemophilia. أولاً chronic arthropathy. To prevent this, you should start early on with a prophylaxis regime to prevent recurrent bleeding in the joint and prevent arthropathy. Then development of an inhibitor to either factor 8 or factor 9. It is also a common complication in hemophilia A or B. 3 transfusion transmitted infectious disease. تأخذ blood transfusion can induce hepatitis B, C, HIV, CMV, toxo, malaria, and these are the diseases which are transmitted by the blood. Also can be transmitted by the factor which is given to treat the bleeding in hemophilia. Comprehensive care. Comprehensive hemophilia care centers should be initiated. Such centers are dedicated to patient and family education, prevention, and treatment. The patient should be educated for the complication of the hemophilia, including chronic joint disease and inhibitor development, as well as infection. Such center should involve a team. Should be treated. These patients should be treated as by a team therapy. A team that includes physician, nurse, orthopedist, physical therapist, and psychosocial workers. Now we will start with von Willebrand disease. It's also a common bleeding disorder. Von Willebrand disease is inherited autosomally. A mutation in different loci that code for different functional domains of the von Willebrand factor protein cause the different variant of the von Willebrand disease. Von Willebrand disease is a different variant. And von Willebrand disease is classified on the basis of whether the protein is quantitatively reduced but not absent. يعني هون قلة كمية، الكمية قليلة يكون type 1. لكن qualitatively abnormal نوعية غير طبيعية type 2. but إذا هالفاكتور هذا von Willebrand factor إذا absent at all it is type 3. von Willebrand factor has two functions. ما هي فوائد هذا العامل؟ أولاً to play an integral role in mediating adherence of the platelet at the site of endothelial damage, promoting formation of the platelet plug. يعني يحفز لنا الأقراص الدموية حتى تلتصق مع بعضها في منطقة اللي يصير بيها الانجري للبلاد فيسل. فالعامل von Willebrand factor عنده a good role for the adherence of the platelet at the site of endothelial damage. ثانيا bind and transport factor 8 protecting it from degradation by plasma protease. يعني يحمل لنا العامل الثامن ويحافظ لنا علينا، بالإضافة إلى أنه يساعد على تجمع والتصاق الأقراص الدموية. Clinical manifestation of von Willebrand disease: mucocutaneous bleeding, cutaneous bruising, and menorrhagia. In severe disease, the patient may have manifestations similar to hemophilia A. Von Willebrand factor is an acute phase protein, so stress will increase its level. Acute phase protein, which will be increased in any stress. Laboratory finding: activated partial thromboplastin time may be prolonged if the factor 8 is low. مثل ما ذكرنا بأن هذا العامل يحمل لنا الفاكتور 8 ويحافظ علينا، فمعناها راح يصير prolongation في الactivated partial thromboplastin time إذا تأثر factor 8. Bleeding time are prolonged. Bleeding time prolonged في حالة platelet dysfunction وبحالة severe platelet deficiency إذا كان عددها أقل من 40,000، وبحالة injury to the blood, disease of the blood vessel itself. فالحالة هذه bleeding time prolonged. platelet number normal. PT, prothrombin time and thrombin time are normal. Platelet function analysis has been considered as a screening test for von Willebrand disease. Von Willebrand factor testing including activity of the factor with structure and the antigen. Molecular genetic testing for von Willebrand factor disease variant is available. Molecular genetic testing التشخيص النهائي لأي مرض هو genetic testing. Treatment of von Willebrand disease depend on أولا the type of the von Willebrand disease type reason for the treatment. In general, type 1 von Willebrand disease patient may be treated with desmopressin. The treatment of type 2 and 3 von Willebrand require von Willebrand factor containing concentrate similar to the treatment of hemophilia. For all types of von Willebrand disease, Therapy should be considered when possible, such as the use of antifibrinolytics such as aminocaproic acid for oral surgery or hormonal treatment for menorrhagia. These are adjunct therapy يعني مساندة أو مساعدة. Dental extraction and sometimes nosebleed can be managed with desmopressin and antifibrinolytics. بعد ما تحدثنا عن الهيموفيليا والفون ويلبراند فاكتور راح نتحدث عن ال disorder of the platelet. The normal platelet count is 150 إلى 450 per liter. Thrombocytopenia refers to a reduction in the platelet count to less than 150. Although clinically significant bleeding is not seen until count below 50 يعني الرينج الطبيعي 150 إلى 450. أقل من 150 يعتبر نقصان بالبليتلت. لكن significant bleeding occur when the platelet decrease less than 50. Causes of thrombocytopenia either decreased production of the platelet or increased destruction of normally synthesized platelet on either an immune or non-immune basis. ITP, idiopathic or autoimmune thrombocytopenic purpura. It is the most common cause of acute thrombocytopenia. Epidemiology. The incidence is 1 in 20,000 children. Onset 1 to 4 weeks after. The peak age is 1 to 4 years. Male and female are equally affected. ITP seems to occur more often in late winter and spring after the peak season of viral respiratory illness. Clinical manifestation. The classic presentation of ITP is a previously healthy child, 1 to 4-year-old, who has a sudden onset of generalized petechiae and purpura. البيتيكياي والبربرا هي سبكوتينس بليدنج تظهر البليتليت بحالة البيتيكياي بحجم رأس الدمبوز أو أقل من 0.3 سنتيمتر يعني 3 مليمتر أقل من 3 مليمتر. من ال 3 مليمتر إلى 200 مليمتر نسميها purpura. The clinical presentation can be classified into no symptom أو mild symptom or moderate symptom or severe clinically. Differential diagnosis. If we see a patient with generalized petechiae purpura, what are the differential diagnosis? The presence of abnormal findings such as hepatosplenomegaly, bone or joint pain, or remarkable lymphadenopathy suggest other diagnoses such as leukemia. عادة مريض ال ITP يكون stable, healthy, no lymphadenopathy, no hepatosplenomegaly, active, no fever, no joint pain, no bone pain. لكن إذا لاحظنا على المريض أي علامة من العلامات مثلا bone وjoint pain, hepatosplenomegaly, lymphadenopathy لازم نفكر بالmalignant disease. When the onset is insidious, especially in an adolescent, chronic ITP or the possibility of a systemic illness such as systemic lupus erythematosus is more likely. Outcome يعني prognosis. In 70 to 80% of children who present with acute ITP, spontaneous resolution occurs within 6 months. يعني good prognosis. Less than 1% of patients develop an intracranial hemorrhage but approximately 20% of children go to have chronic ITP، يعني تبقى عنده أكثر من سنة، من بقت أكثر من سنة نسميها chronic ITP. laboratory finding: platelet number is low، أقل من الحد الطبيعي. البون marrow show normal granulocytic and erythrocytic series with normal or increased number of megakaryocytes. HIV study should be done in a risk population. Platelet antibody testing is seldom useful in acute ITP and rarely نحتاجه. A direct antiglobulin test comes test if there is unexplained anemia to rule out Evans syndrome. الإيفانز syndrome هو عبارة عن هيمولوجيك أنيميا زائد ثرومبوسايتوبينيا. فإذا فكرنا بيه نعمل direct Coombs test. إذا direct Coombs test positive معناها Evans syndrome. An anti-nuclear antibody should be considered in adolescents. indication for bone marrow aspiration، يعني المريض وصلنا احنا محتارين نعمل له bone marrow or not. In ITP there is special indication for bone marrow. أولا إذا كانت الوايت بي سي abnormal count or differential count abnormal or unexplained anemia or finding in the history of physical examination suggestive of bone marrow failure syndrome or malignancy. مثلا نرجع نعيد مريض ال ITP من الهيستوري he is stable no lymphadenopathy no hepatosplenomegaly. من ال laboratory investigation الوايت بي سي count and differential normal و he has no anemia. لكن إذا شفنا بالhistory أو physical examination أو laboratory investigation anything any hint to suspect malignancy you should do bone marrow aspiration. The treatment of ITP therapy seldom is indicated for a platelet count greater than 30. عادة بما أن أكثر من 80% تصير فيها spontaneous resolution، فننتظر على المريض إذا كان stable وخاصة البليتلت أكثر من 30,000 ما نستعجل ما نعالجه فقط observation. platelet transfusion في حالة ITP is usually contraindicated لأن البليتلت عمره قصير ما تفيدنا وهي المرض autoimmune راح تتحطم أيضا ويستفاد من المرض. فقط في حالة اللايف threatening bleeding is present في الحالة نستعمل كل الأسلحة اللي في متناول اليد لإنقاذ حياة المريض. Initial approach to the management of ITP include the following. First, no therapy مثل ما ذكرنا، فقط education and counseling of the family and the patient for patient with minimal mild or moderate symptom. Intravenous immunoglobulin, particularly for children who present with mucocutaneous bleeding, at a dose of 0.8 to 1 gram per kg per day for 1 to 2 days. يعني هذا الاميونوجلوبولين نحسب الجرعة 1 غرام لكل كيلو. إذا وزنه مثلا 30 كيلو يحتاج إلى 30 غرام باليوم لمدة يومين. This will induce rapid rise in the platelet count. Very effective. Corticosteroid. The dosage of prednisone is 1 to 4 mg per kg for 24 hours, usually continued for short course until rise in the platelet count to more than 20. عادة خلال أسبوعين بدي ترتفع البليتلت، فإحنا نستعمل الكورتيكوستيرويد في هذه الفترة. The role of splenectomy in ITP should be reserved for. ما نفكر بالسبلينكتومي إلا في حالة أولا the older child more than 4 years with severe ITP that has lasted more than 1 year يعني chronic ITP whose symptoms are not easily controlled with therapy. المريض يعاني من chronic ITP and severe وعمره عبر ال4 سنين ونفكر بالسبلينكتومي. or when the life-threatening hemorrhage, intracranial hemorrhage, complicate acute ITP if the platelet count cannot be corrected rapidly with transfusion of platelet and administration of intravenous immunoglobulin and corticosteroid. في حالة life-threatening hemorrhage خاصة intracranial جميع الأدوية التي ممكن نستخدمها ونحضر المريض للسبلينكتومي immediately. As an alternative to splenectomy, rituximab has been used, but it is off-label in children to treat chronic ITP. In 30 to 40% of children, rituximab has induced a partial or complete remission, but it is off-label. Off-label يعني ما مذكورة indication, contraindication, side effect, accurate dose for children. Thrombopoietin receptor agonists have also been used to increase the platelet count and are approved for pediatric use in patients with chronic ITP who remain at risk of bleeding following the treatment with first line therapy. يعني هو عنده chronic ITP وعندنا الفيرست لاين ثيرابي اللي هي كانت الجلوبولين والكورتيكوستيرويد وما صار عنده ريسبونس نستخدم thrombopoietic receptor agonist. في حالة الانتركرانيال hemorrhage, the treatment is أولاً platelet transfusion, intravenous immunoglobulin, high-dose corticosteroid, prompt consultation by neurosurgeon and surgery for splenectomy. In case of chronic autoimmune thrombocytopenic purpura, about 20% of the patients who present with acute ITP will be chronic because they have persistent thrombocytopenia for more than 12 months and more than 1 year and are said to have chronic ITP. Chronic ITP من يطول المريض أكثر من سنة with ITP. وبهذا نأتي لنهاية المحاضرة الخامسة Bleeding Disorder اللي تحدثنا بها عن الهيموفيليا بأنواعها وعن الفون ويلبراند ديزيز والإيديوباثيك ثرومبوسايتوبينيك بوربرا. نلتقي إن شاء الله في المحاضرة السادسة اللي راح تكون عن اللوكيميا. اللي أرجو من حضراتكم جميع طلاب المرحلة الخامسة قراءة المحاضرات اللي ننزليها على نفس برنامج المودل بس على شكل PDF. وشكرا.